all, I want to thank, say many thanks to organizing committee for inviting me on such important event in our life. And my presentation will be only a very brief, maybe not full summary of a previous brilliant presentation, brilliant report of my colleagues. What do we know? What we should know? First of all, climate change, you know about this too much today, and Russia is not an example, is not an exclusion, as a very good example, and you can see the temperature trend is continue to grow and the speed continue to rise, and annual surface temperature anomalies in circumpolar area, and not only in Russia but also in our country, who have territory in circumpolar area, also continue to grow in the summer, in the winter, in air, in water, and permafrost continue to melting, and we have very big part of degradation of permafrost, which lead to deformation of building, destroying of roads, and break of communication between area of habitat of people. And we know what permafrost melting increase the risk of release of dangerous and known microorganisms such as Spanish flu, plague theoretically, and anthrax. And you can see a very good example of anthrax outbreak. About this outbreak, my colleague already presented information, and many ancient and maybe also unknown microorganisms can release from permafrost due to melting. It is fallen. Prokaryotes and eukaryotes microorganisms can persist in condition of permafrost during many years. Follow microorganisms were isolated from permafrost, aerobes and anaerobes, green and blue-green microalgae, yeast, mycelium fungi, and viable cyst of free living protozoa. Some of them can be resistant to natural antimicrobial and maybe can resist to artificial antimicrobial drugs which we use now in our clinical practice. And awakened bacteria will begin to produce carbon dioxide and other green gases like methane and lead to even greater climate warming, and it is a very big problem. Lead to climate warming and many vector-borne disease, and not only vector-borne disease, also anthraponosis move to north and increase risk of infectious diseases in the circumpolar areas like tick-borne encephalitis and West Nile fever, hemorrhagic fever with renal syndrome, Karelian fever, rabies, chikungunya, Lyme disease, tularemia, brucellosis, etc., and also hepatitis A and infectious diarrhea. And you can see now prognosis of extended area of habitat of Exodus ricinus in the territory of Russia, and according to extreme scenario, you can see what expanded area to the north will be more great than we have now. And like example, situation in Arkhangelsk regions is also close to Yamal regions. relatively close. And in previous time, only southern part of Arhangelsk region suffered from tick-borne encephalitis, and now expansion of tick-borne encephalitis go to the north, and you can see what almost all parts of Arhangelsk region suffered from tick-borne encephalitis, and if you can see situation about morbidity from this disease in Russia, it is enough stable, but continue to deteriorate in the northern part of Russia, especially in the Arhangelsk region. And one more extreme scenario to extended area of Aedes albopictus, and you can see also now a very brilliant presentation of my colleague Professor Semenza about a situation relating to chikungunya, dengue fever. It's also like example, it is a vector of chikungunya, and according to this scenario, Aedes albopictus will go up to the North Territory and achieve also circumpolar area in the future. And why not? Dirofilaria are also vector-borne dirofilariosis, vector-borne diseases, and also very simple insect culex bring these parasitic diseases, and also we detect this disease in the northern part of Russia, also in Arhangelsk region and Murmansk regions. And finally, occurrence and expansion of ozone holes, increased air pollution due to climate change and global warming, mentioned a few species of flora, also due to climate change, increasing in the duration of high temperature and the number of heat waves, growth of allergy, reduction of factor of innate immunity and stress lead to increased susceptibility to any infectious diseases, any climate-dependent and not climate-dependent, in particular infectious of respiratory tracts, acute respiratory diseases, and pneumonia. And I can only one more time show information about what epidemiological well-being in the Arctic is very, very illusory and due to climate change, and we need to act, and measures for adaptation of population and mitigation of climate change, strong control, monitoring, prognosis of infectious diseases threaten the source, and developing and the restructure of the preventive measure for population. It is necessary. Global forces for reduction speed of climate change in the north are necessary, and only together we can find a solution. Many thanks.
Thank you.
First, I've kind of got several semi-connected points here. The first one is that there are indeed, as was mentioned in the previous talk, lots of sites in the Arctic where people have had diseases and been buried. Some of them are fairly recent, and there's perhaps more concern with the more recent stuff. This is a measles grave from the early 1900s, very close to the airport in Barrow, Alaska, now known as Ukpeavik, and previously known as Ukpeavik.
Right.
There's very few people who actually know that this is a measles grave. I get called out there probably every other year because although there aren't any visible in this picture, there are a number of human remains that have surfaced, and people find them, and I'm the archaeologist, so yes. So the thing is that there is other places where there are very similarly non-obvious buried populations. This is a mass grave. Half the town died, and a couple of Euro-Americans who had measles and therefore were immune basically wound up burying everybody. So, graves. Archaeologists do excavate graves. If we know we're excavating graves, we do tend to take precautions, although in this case there are probably more for keeping our DNA off the bones than the other way around, but it can go both ways. And if you're knowledgeable about there being a contamination or a potential of illness, people would be careful. However, we also excavate a lot of other things, and most of those there's really no way to know what can be in the soil. I mean, people talked about coming up with all kinds of things out of soil samples. This is actually the excavation of a 1940s meat cache. I could actually tell you who did it, which had 3 mummified ring seals in it. This is Patou, named by one of our French excavators. Patou actually extended the known existence of harmful algal blooms, particularly relating in domoic acid, literally doubled the time that we can document it, because we were able to get domoic acid from Patou's intestines. In the early 1940s, he was caught and put in this thing. Now, the reason, and this may be the reason why I'm here, that microphone over there belongs to Micheline Duclef, who works for NPR, and she was very excited about the possibility of this, particularly because this fellow here managed to get himself an infection on his leg, which fortunately responded to antibiotics. He was convinced he had seal finger. She was convinced he had seal finger. She had just gotten back from doing something on Ebola, and so she was very into this whole sort of, but the point being here, in fact, that he did contract some kind of an infection. Now, but it can happen. Now, moving on a little bit to jumping over. So one of the things that I was asked to say something about was traditional knowledge. So I spent a lot of time talking to people about whether there was particularly a traditional knowledge of episodics. Not so much. People do examine animals when they catch them. They look very carefully at them when they're butchering them and cutting them up. If they see anything that doesn't look right, if they see infected areas, whatever, they generally just won't eat them. We have in the North Slope a fairly large Department of Wildlife Management, which has veterinarians and as well as various other kinds of scientists, and so they actually do sample and they'll send stuff out to labs. Can't do a lot of stuff on slope. So people do try to pay attention. When you're cutting open fish, if they're full of worms, they're not going to eat the fish. Of course, they might give it to dogs. I suspect that happened more in the past. The other thing that is a potential problem is that a lot of traditional food for preparation involves fermentation. So in fact, you do want bacteria because otherwise it's not going to, changes aren't going to happen. One of the big delicacies is Ukpeavik, which is whale blood, whale blubber, whale meat, various other pieces of whale all put in a container and stirred. And you have to stir it a lot. The problem has been lately in a lot of areas of the state with some of these things that people transition from having wooden or hide containers which transmitted some oxygen back and forth to plastic 5-gallon buckets, which are really, really great, easy to clean. People think, and they've all been trained to clean things. The only problem is that it basically tends to get anaerobic in there, and people keep winding up with botulism. There's some issues there. People are gradually becoming more aware of that. But some of these are actually pretty, they undergo a lot of fermentation. There's actually fermented walrus flippers, produce an altered state of consciousness, shall we say. So food storage. Now, things in the ground. This is where you store a whale. This is an ice cellar. This is Jeremiah Levitt and my husband Glenn Sheehan in Jeremiah's ice cellar. And they clean them out. They fill them with snow every year. You need a nice clean one for the whale to come. And won't give himself if you've got a dirty, stinky place. So there's a certain level of keep it clean and whatever. But at the same time, the idea of getting things out of the ground to eat is, and it being safe as a place to be is very, very important part of the culture. I mean, ice cellars are better than freezers. So that's kind of the food thing. And then popping to the third possible way I see of people being exposed in the Arctic is these rather dramatic, sudden collapses. This is a permafrost collapse at the site of Ukpeavik, which is actually where that seal was. It was back over there. This is the result of one single storm. We lost about 31 meters of the site. A lot of it's sort of up that way. when I took this picture. But this is all organic material. At the very bottom of this, though, it reaches the Pleistocene. And there's actually, in some other areas, maybe even in the corner there, you actually have exposure of Pleistocene soils. We have excavated Pleistocene rodent burrows in this. And it's full of artifacts. And it's also full of, this is actually ice cellar Point Hope that has been eroded rather badly. But see, there's lots of nice whalebone. Now, whalebone is a particularly great thing for carving. People basically make their living by carving in some cases. And stuff that's archaeological is really great because it has lost a lot of the oils that are in it, so it makes it much easier to sell. If you take fresh whalebone and carve it, it's going to stink if people keep it in the house, so not a good plan. The thing is that people go to archaeological sites, and this is a third one, Inupiaq, and you can see that it's eroding rather badly. But what they do is either to get artifacts for subsistence, shall we say, they're able to collect and sell them, otherwise known as looting, but in many cases this literally is the only thing people have to do in their community, not so much for us, but a lot of places. Or to get the whalebone, they go through all the stuff that falls out, and whatever they don't want winds up on top. See how there's all that nice white stuff up there? So this means that people are being, if there is anything in any of these things, that there is a high probability that somebody's going to get into it. There's also people in some areas where there's mammoths and other things that are frozen in. When they collapse, they mine for it. Both, I mean, that's the case in Siberia, and it's also the case in parts of Alaska. So they're deliberately going out and trying to find this stuff. And you can see all the tracks, the four-wheeler tracks and whatever. This isn't one or two people going by there. This is lots of people. So that's basically a short nutshell.
Thank you.
Good afternoon. I'm Dmitry Orlov from Moscow. I'm medical geographer, health geographer, we can say, and I would like to tell about experience of our medical geography group and, of course, about situation on infectious diseases in Russian Arctic. We published 3 atlases and medical geographical atlases. Is Syria. 2 atlases on natural focal diseases. We call it natural focal diseases according to Pavlovsky's theory of natural focality or natural nodality. It's more wide than just zoonotic diseases. And the new one on healing springs and plants, but there is a part on public health in this atlas too. But all of these atlases are in Russian, and then we published a book in English, and it consists a lot of information of distribution of diseases, natural factors, and range of different hosts and vectors of these diseases. You can find them in internet. Also, I'd like to tell about the main branch of our research. First of all, it's nosogeography, distribution of different diseases in Russia. The second, geography of hosts and vectors. You can see just some examples of our maps. For example, distribution of different rodents, fish, density of birds and vectors, mosquito vectors on this map, Aedes, Anopheles, and Culex genus. On this example, on tick-borne encephalitis, I would like to say about one important thing about the data on human diseases. Yes, usually we have a data on administrative units. Yes, and if we can see on the map on distribution of tick-borne encephalitis in Russia, yeah, we can see that it's everywhere. But we decided to prepare a more detailed map, and for example, we'll take the borders of ticks distribution, of Exodus persulcatus and Exodus ricinus, the main vectors of tick-borne encephalitis in Russia. And we prepared map, and we can show real situation, yes, on distribution of this disease in Russian territory. Of course, we have work on climate changing, the areas, the range of different hosts and vectors. The borders are shifting, and for example, as Natalia already said, we have 2 new dangerous species of mosquitoes in the south of Russia. It's Anopheles, Aedes aegypti and Aedes albopictus. And I would like to show you just some examples of our work on climate change and disease. It was a project that finished a few years ago. We used IPCC climate scenario A2 for modern climate and prognostic climate for the middle of century and the end of century. I don't have a time to explain it more detailed, but as a result, we prepared maps for probability of malaria transmission in European part of Russia, and we can see situation for modern climate, for middle century, and for the end of century. Of course, it's for vivax malaria. We know that there are four types of human malaria. But for Russia, it's more actual vivax malaria. And this example on West Nile fever, it's quite new disease for Russia. The first case was registered in the south part of Russia just maybe 15 years ago. And on this, we published this map about 5 years ago, I think. This potential area of West Nile fever, we used different parameters, different limits for arbovirus distribution, and we marked regions where West Nile fever were registered, yes. And now our forecast came true. Unfortunately, it's good for us as for scientists, but unfortunately for people. And I would like to shortly talk also about Russian Arctic. This is official territory of Russian Arctic on government level. Yeah, this is polar circle. And when we talk about Arctic, we mean this territory. And this is a list of more dangerous diseases in Russian Arctic. First of all, anthrax, yes. Also tularemia, because we know that agent of tularemia, Bacterium Francisella tularensis, can survive in soil and in permafrost, also like anthrax spores. Not so long like anthrax, but anyway. We have some local cases of leptospirosis and a lot of different helminthosis. I don't add in this, maybe we can add also rabies for this Arctic zone. And I did not write here about tick-borne diseases, because there is no ticks on this territory. And if we tell about some social determined diseases, of course it's problem with HIV, I suppose, and tuberculosis, because there are a lot of areas of oil and gas extraction on the Russian north, and there are a lot of seasonal workers from different parts of Russia, and I think we know about situation on tuberculosis, that maybe it's not so bad, but drug-resistant tuberculosis, now it's problem in Russia, in whole territory of our country. Okay, thank you.
Thank you. Well, thank you, everyone. My name is Jay Butler, Deputy Director at the CDC, and in that role, I have oversight of the 3 infectious disease centers, including the beloved Center for Emerging and Zoonotic Infectious Diseases, which gives me the opportunity to work with Dr. Bowers as well. And we recognize that it is only us standing between you and lunch, so I will try to keep going here. A year ago, I was the Commissioner of Health and Social Services in Alaska, and for the past 4 years, I have been the Chief Medical Officer for the state. So I want to thank you for the invitation to speak, and thank you for asking an Alaskan and several Alaskans that are here today. So with 45 seconds each, I'd like to just offer some observations of what's happening right now, which is why I chose the Tom Clancy-esque title of Clear and Present Danger, of what's happening with infectious disease threats in Alaska related to the changing climate, specifically higher ambient atmospheric air temperatures, warming seas, thawing of the permafrost, and reduced sea ice. So starting with the warming, there's upsides. I saw other family pictures earlier, so I thought I'd throw in mine too. And I knew by this point in the program we will have seen plenty of graphs and maps of warming temperatures, so I thought I'd make it a little more subjective. It was 32 degrees centigrade in Anchorage in early July this year. That had never happened before. So again, just a point in time, but it raises the questions as we look at some of the background data of the overall warming. What are some of the impacts of that? The one example I'm going to point to is concern about vector-borne disease, which keeps recurring during the discussions today. Looking down in what we call the United States of America, there's been the expansion of the ranges of Exodes scapularis and Exodes pacificus, concern about the northward migration. Emily, I want to talk to you later about your assessment of vector-borne diseases. I'd like to think Canada is going to defend us from all these darn American ticks, but I ain't buying it. And at least anecdotally, we had heard increasing numbers of reports of people finding ticks on particularly companion animals, mostly dogs, but also few reports of finding them on humans, which are still not real well substantiated. While we've had ticks on wildlife for a number of years in Alaska, there is concern that we're seeing species that we have never seen before in people lacking travel history. So Dr. Bob Gerlach, the state veterinarian, has started a program to be able to submit ticks. This is just getting going. I wish I could present some data, but I raise this as an example of where the concerns have been raised because of increasing numbers of reports from the communities, from citizen scientists. You've seen this slide already today, talking about warming sea temperatures. This was the outbreak of Vibrio parahemolyticus that occurred in Prince William Sound back nearly 15 years ago now. So not necessarily a recent event. It was linked to consumption of oysters from Prince William Sound. It was one of the first times that the water temperature of Prince William Sound had gotten above 15 degrees centigrade for a prolonged period. Now, I wanted to just have a chance to talk about, is this due to a severe weather event, or is it due to changing climate? Because that is a discussion that, at least in the United States, happens a lot. Are what we observing due to weather, or is it climate? So this is only 2 months worth of data. But looking at the temperatures, the Department of Environmental Conservation in Alaska has monitored the temperatures of Prince William Sound going back for a number of years prior to the outbreak. And there was an upward trend, and this graph just shows the water temperatures at a 5-foot depth during July and August, and the red line shows 15 degrees centigrade, and you can see that more and more time the water temperatures are above that level. Now, trying to look at a broader time range, we don't have measurements from Prince William Sound, but out in the garden spot of the Gulf of Alaska, NOAA buoy 46001, we have about 30 years worth of data. And these are surface temperatures, and you can see that there is a general upward trend. So, you know, I don't think there's a clear red line that you step over when you say this isn't a severe weather event, this is climate change. But to me, this points towards changing climate influencing an infectious disease risk and contributing to an outbreak of a foodborne disease in Alaska. Thawing permafrost, we've already talked about traditional ice cellars. This is a photograph that I think comes from Mike Brubaker, the entrance to an ice cellar, and down in an ice cellar where this gentleman fortunately is wearing chest waders because it's thawing and there's standing water down there. Concern about food safety related to that. I'm not aware of any foodborne outbreaks related to thawing of food in traditional ice cellars, but it certainly is a concern, and we're seeing this degree of melt. And this just shows some of the warming that's occurring, a number of 20 meters down in different parts of Alaska. So permafrost is warming, permafrost is thawing. And lastly, the loss of sea ice, a couple of impacts of that. One is when storms occur, the ocean crashes in because it's not frozen anymore. This is damaged infrastructure. This is actually a sewage treatment plant in one of our more remote villages, and it led to several months of loss of potable water and lack of access to wash water. We do have good data that shows that in villages with less access to wash water, there are higher rates of respiratory tract infections and skin and soft tissue infections. We have not shown that an event like this is directly related to human disease, but the risk is certainly present. This just shows in the Chukchi Sea the loss of sea ice, the amount of time where more than 50% of the water is open. And then was mentioned earlier also tourism, movement of humans. This is something I never thought I would see. This is a major cruise ship off the coast of Nome, and you can actually see, this is another reflection of how warm it is. Somebody's swimming here in Nome. This cruise ship had several hundred passengers, of course, and actually circumnavigated all of Alaska, then through the Northwest Passage across northern Canada, and then down to New York. I don't think that's happened again, maybe in part because they met 45-foot seas when they were up in the Chukchi Sea. So I don't know how much fun that cruise really was.
Why are the fires there? Why are the fires?
Just on the beach bonfire, probably to warm up that guy who was going to be hypothermic when he came out of the ocean. And last, we did do a health impact assessment for the state. And it includes the broader assessment of the impact of the changing climate on mental health, on substance abuse, as well as on infectious diseases. So the link to that is there. I think if you just Google Alaska, potential health impacts of climate change in Alaska, it'll take you right there. So thank you for the opportunity to speak.
Thank you.
Thank you, everyone. And I do realize that I am the impediment between you and lunch, so I will try to be quick.
Talk fast, sir.
Okay, so I'm going to talk about specifically one pathogen, anthrax in the Arctic, and what we should potentially look at doing to prepare for its arrival. So first I'm going to talk a little bit about the epidemiology of anthrax and its infectious cycle. So Bacillus anthracis is a gram-positive bacillus, and importantly it is a spore-forming organism, which makes it very suitable for living for a long time in the environment. It is known to last a long time in temperate climates in the environment. It could probably last forever in the frozen permafrost. And we know that it's a significant public health concern. Outbreaks result in the death of a lot of animals and livestock, as we saw in the Russian outbreak in the reindeers. And it also can cause significant disease in humans as well, with an estimated burden of 2,000 to 20,000 cases per year worldwide, mostly in the African areas, but you can see that there have been large outbreaks that result in many human cases. So just quickly, the life cycle of anthrax, if you start, yes. So if you start over here on your right, animals grazing, herbivores grazing will eat the spores, which will result in anywhere from 1 to 14 days in rapid death, with a large amount of bacteria circulating in the bloodstream at the time of death. And these bacteria come out from orifices, or scavengers can open them up and spill them into the environment. When they go out into the environment, they form spores, and there are certain soil conditions, environmental conditions that are better for them to form spores, such as a higher soil pH and high water content, calcium content, and organic material content. And then these spores, as I said, will last for a long time in the soil, and animals will pick them up, starting the cycle all over again. There is some evidence to suggest that insects may be mechanical vectors as well. And then humans are sort of secondarily infected when they come in contact with dead animals, either through eating, consuming, scavenging the dead animals, or from their products, such as skinning hides and such. Could you make it go forward? I'm sorry. It seems to have lost that ability. So we know that anthrax occurs in the Arctic region. I should probably just skip over this. This is where, okay, thank you. So, yes. So now I'm going to talk a little bit about the suggestion that anthrax could become more prevalent in the Arctic region. Next. So ecological niche modeling. You've already seen some ecological niche models for other people have put up before, but basically they're computer algorithms that input environmental and ecological information to predict where pathogens are more suitable for pathogens to survive. So for our models for anthrax, we use environmental variables such as temperature, precipitation, such as ecological inputs, such as the soil characteristics I talked about, and then data on where outbreaks occur. And these will allow us to maybe predict where anthrax may occur. Next. So here is a worldwide model, and if you go from blue through red, you see from low to high suitability for anthrax to occur, or the Bacillus anthracis spores to occur worldwide. Next. So here, you've seen this before, this is a worldwide distribution of permafrost. The only thing I will say is added to this is that you can see where our anthrax outbreaks occurred that we put into our model. Next. So now if you overlay the two models, you can see these areas that in going from blue to yellow to red, where the models predict that in the Arctic region where anthrax is most likely to occur. Next. So now, what do we do to prepare for this potential emergence of anthrax? So we need to build capacity to detect anthrax. So in places where anthrax might occur, you need to look to see if there are protocols in place, if surveillance is capable of detecting anthrax, and if not, you need to look into ways to enhance that capacity to be able to detect an outbreak of anthrax. So next. So to do this requires a multi-sectorial approach where you have both, since it's a zoonotic disease, you need both human health involvement and animal health involvement. And this, happens at the local level because all responses are local, but also needs to happen at the regional and national level as well. So next. So at the local levels, need to have the capacity to diagnose the cases, which as we need surveillance, as someone mentioned before, medical surveillance in these areas to detect these potentially emerging organisms, and the ability to diagnose, or at least make a preliminary diagnosis at the local level. At the regional level, there needs to be surge capacity to be able to help in the response, and maybe also have the ability to do more sophisticated laboratory diagnosis for confirmation of the outbreaks. Next, so then at the national level, because as was pointed out, this is a One Health approach is needed for these zoonotic diseases, so there needs to be national policies to promote the collaboration between the human and the animal health, and these policies should be focused on prevention and control through vaccination programs, carcass disposal, and potential quarantine, and also to be able to provide technical support in support of the local event, and then need to have a mechanism for reporting of these outbreaks and occurrences. Next. So, just in summary, I believe that anthrax does have a potential to emerge in the Arctic region. We've seen examples that it has, and there's modeling to suggest that it can occur in other regions where it hasn't been reported previously. So we just need to prepare for this with a system that has surveillance and the ability to diagnose these potential cases. Thank you.
Thank you.